My father snatched my hospital chart off the counter before the nurse could reach it. "Sir, you can't." He ignored her, flipped one page, and gave a short laugh. "There's nothing wrong with her." I was curled on the ER bed with my knees drawn up, sweat sliding down my neck. One hand pressed so hard into my stomach, my fingers had gone numb. The monitor beside me kept beeping too fast. My mother stood by the curtain, arms folded, whispering to the nurse like I wasn't in the room. She does this when people stop paying attention. I try to lift my head. "I fainted this morning. There was blood." "I told you." "Mara," Dad said, without even looking at me. "Stop performing." The nurse's eyes moved from his face to mine, then to the blood pressure cuff tightening around my arm again. This time, her expression changed. The number dropped. She stepped out fast and called for another nurse. I was 22, old enough to sign my own forms, old enough to be in nursing school, old enough to understand that people in hospitals did not rush unless something was wrong. But I was still on my father's insurance, still living under his roof, still hearing his voice get believed before mine. Mom took out her phone and started typing with both thumbs. I saw the family group chat name flash across her screen. "She created another emergency," she muttered as she typed. "Everyone's going to panic because of this." A second nurse came in with vials for blood work. Someone mentioned a scan. Dad sighed like the hospital was falling for a prank. "She wants a dramatic diagnosis," Mom said into a phone call near the curtain. "That's all." Then the ER doctor came back in. He wasn't smiling anymore. "Mara," he said, "have you ever been told you were anemic?" I swallowed. "Yes. But they said it was because I wasn't eating right." The doctor's eyes shifted toward my father. For the first time, Dad didn't answer immediately. Then the curtain opened. A surgeon stepped inside holding my scan results, his mouth set in a hard line. He looked at my parents and said, "You need to see this for yourselves." Before we continue, drop your city and country in the comments below. And if you enjoy revenge stories like this, don't forget to like, subscribe, and turn on the notification bell so you never miss an update. The surgeon did not show them the scan right away. Instead, he stepped closer to my bed and pulled the curtain halfway shut, putting his body between me and my parents like the room had suddenly been divided into two sides. "I need to examine Mara," he said. "Please step back." Dad's jaw tightened. "We're her parents." "She is an adult patient," the surgeon said. "Step back, please." Mom let out a soft, embarrassed laugh, the kind she used when she wanted strangers to think she was being reasonable. "Doctor, before you go too far with this, you should know she exaggerates pain. She always has. We don't want hospital resources wasted because she's having one of her episodes." I stared at the ceiling tiles. One of them had a brown water stain shaped like a crooked hand. I focused on that instead of Mom's voice. It was easier than watching the nurse hear the same story my relatives had heard for 3 years. When the stomach pain first started, I was 19. It came in sharp waves that made me grip the bathroom sink until my knuckles went white. Dad said I was reading too much online. Mom said nursing school had made me suggestible. When I missed classes, Dad told my aunt I was becoming fragile. When I lost weight, Mom posted online about how hard it was raising a daughter who turned every inconvenience into a crisis. Back in the hospital room, the surgeon pressed gently along my abdomen. I flinched. Dad made a noise under his breath. The surgeon looked at him once, then asked me, "How long have you been bleeding?" Before I could answer, Dad said, "She says that when she wants sympathy." Something in me snapped, not loudly, not bravely, just enough. "I have photos," I said. The room went still. My voice shook, but I kept going. "Dates too. And a symptom log." I started keeping it because no one believed me. Mom moved fast. "Mara, give me your phone. That is private family business." Her hand reached over the bed rail. The surgeon stopped her without raising his voice. Her medical history belongs to her. Mom froze. For the first time that night, someone said a sentence my parents could not talk over. I unlocked my phone with trembling fingers and opened the folder I never wanted anyone to see. Photos. Notes. Dates. Pain levels. Times I fainted. Times I found blood. Times I was told to stop being dramatic. The surgeon scrolled slowly. His face changed by tiny degrees. Then he asked, "Did anyone follow up after the abnormal labs from your old clinic?" I blinked at him. What abnormal labs? Dad's face hardened. Dad stepped out into the hallway before the surgeon could answer me. I heard his voice through the curtain, low at first, then sharper. "Linda, you need to get over here. Mara is trying to turn the hospital against us." My aunt. Of course he called my aunt. She was the person everyone in the family listened to when things got messy. She organized birthdays, holidays, church potlucks, funeral meals. If Aunt Linda believed something, the rest of the family usually followed. Dad knew that. Within minutes, my phone started buzzing against the blanket. A message from my cousin Joel appeared first. "Stop scaring your mom." Then one from Aunt Linda. "Your father says the doctors are confused. Be honest with them, Mara." Then another. "You've taken this too far." I stared at the screen while the fur pulled at my wrist. Mom came back from the waiting area with her own phone in her hand. She wasn't looking at me. She was typing. A second later, the family group chat lit up. Mom had written, "Please pray for Mara's mental health. Doctors are checking her because she insisted. We are exhausted." My throat tightened so hard I couldn't swallow. Even here, under fluorescent lights, in a hospital gown, with bruises blooming where they had drawn blood, she was still telling the story before I could. Then my younger cousin sent me a screenshot privately. It was Mom's message, circled in red, with 3 words underneath. "Is this true?" I didn't know what to type back. The nurse returned with a consent form for a contrast scan, explaining that the doctor wanted a clearer look at the bleeding source. Before she could finish, Dad walked back in and took one step toward her. "No," he said. "She doesn't need that." The nurse looked at him carefully. "Mara is the patient. I need to discuss this with her." "She's anxious," Dad said. "She gets worked up and then everyone rewards it."
"I want a scan," I said.
Dad's eyes cut to me. He moved close enough that only I could hear his next words. "You keep embarrassing this family, and I stop paying your tuition. You understand me?" The room seemed to shrink around that sentence. For 3 years, that had been the leash. Tuition, insurance, the bedroom in their house, the car I borrowed to get to clinicals. Every piece of my life had a string attached to his hand. The nurse noticed my face. "Mara," she said gently, "is anyone pressuring you to refuse care?" Dad straightened. "That is an insulting question." Before he could say more, the surgeon came back with the scan report in his hand. He didn't look at Dad first.
He looked at me.
"Mara, the imaging shows signs of repeated bleeding," he said. "Not one sudden episode. This has been happening over time." The hallway outside went quiet. Aunt Linda had arrived. She stood just beyond the open curtain with her purse still on her shoulder, lips pressed together, ready to scold me. But she had walked in just in time to hear the surgeon.
Dad turned.
"Linda, this is being blown out of proportion." The surgeon's voice stayed steady. "This is not attention-seeking behavior. This is a documented medical problem." Aunt Linda's eyes moved from him to me, then to my mother. Mom's face went pale, but only for a second. Then she lifted her chin and said, "Then she must have hidden it from us." I pushed myself up on one elbow, even though pain tore through my side. "No," I said, loud enough for my aunt to hear. "I begged you to believe me." Nobody moved. Then a nurse rushed through the curtain with a fresh lab report in her hand. "Doctor," she said, breathless. Her hemoglobin dropped again. The room changed after that. Not in a dramatic way. No one screamed. No alarm blared. But the nurse's hand tightened around the lab report, and the surgeon stepped closer to the monitor like the numbers had started speaking louder than everyone else in the room. "We need to move quickly," he said. Dad frowned. "Move quickly with what?" "With identifying where she's bleeding," the surgeon said. "If her hemoglobin keeps dropping, this becomes dangerous." "This is ridiculous," Dad snapped. "You're scaring her." I looked down at my own hands. They were shaking so badly the blanket moved with them. The nurse adjusted my fore and said, "Mara, we're going to start preparing you in case intervention is needed." The doctor will explain everything before you sign anything. Dad stepped toward the bed. She's not signing anything until I understand what you people are doing. The surgeon turned to him. She is the one who needs to understand. For once, Dad had no clean answer. They brought forms on a clipboard. Contrast imaging. Possible emergency procedure. Permission to treat if they found the bleeding source. My name was printed at the top, not his. My date of birth. My body. My signature line. The pen felt heavier than it should have. Outside the curtain, Dad's voice rose. You're manipulating her. She's tired, she's scared, and you're pushing surgery on her when she doesn't need it. Mom was crying now, but not quietly enough to be private. This is exactly what she wanted. A whole team around her. A nurse pulled the curtain tighter. The surgeon crouched slightly, so his eyes were level with mine. Mara, he said, the anemia you mentioned, the weight loss, the fainting, the bleeding in your notes, and what we're seeing tonight all fit together. Something has been missed for a long time. Something has been missed. The words landed harder than an accusation. Because I remember the old clinic, the cold exam table, the doctor telling me my blood count was low, and they needed follow-up tests. I remembered Dad driving me home in silence. I remembered the voicemail from the clinic a few days later, and Dad picking up my phone because I was asleep on the couch. Later, Mom told me. They said it was fine. You just need vitamins. The nurse came back with someone I hadn't seen before, a woman with a badge clipped to her cardigan. Mara, she said, I'm the hospital's social worker. I'm here because staff had concerns about pressure around your medical decisions. Dad heard that from the hallway. Pressure, he said. I'm her father. The social worker didn't look away from me. Has anyone ever prevented you from receiving medical care? My mouth opened, but nothing came out. Through the glass, I could see them clearly. Dad red-faced, one hand on his hip like he was arguing with a bill collector. Mom on the phone, wiping tears she wanted people to notice. Aunt Linda standing several feet away from both of them, no longer beside them. The social worker waited. The pen was still in my hand. Finally, I said, I was told I'd lose my home if I kept making appointments. The nurse stopped moving. The social worker wrote it down. Dad shoved the curtain open. That is not what happened. The surgeon entered behind him holding a small stack of papers. His face had changed again. This time, it wasn't only concern. It was certainty. We received records from the old clinic, he said. Mom went still. The surgeon looked from her to Dad. Do either of you remember receiving calls about abnormal labs 2 years ago? Mom answered too fast.
No.
Dad said, those tests were probably nothing. The surgeon lifted the first page. They were not nothing. Then he turned it around. The surgeon laid the records on the rolling table beside my bed. Not dramatically. Not like he wanted a confrontation. He placed them flat, turned them toward my parents, and tapped the first page with 2 fingers. There are the lab results, he said. There are the call notes. There is the follow-up recommendation. I looked down at the paper.
My name was at the top.
Mara Ellis. My date of birth. My old clinic. And underneath it, numbers I understood well enough from nursing school to know they were not normal. Hemoglobin. Ferritin. Iron saturation. Words that had lived in my textbooks were now printed beside my name like evidence. The surgeon pointed to one line. 2 years ago, Mara's blood work showed severe iron deficiency anemia, he said. There were also markers that suggested ongoing blood loss. The clinic recommended urgent gastroenterology follow-up. Mom whispered, we didn't know. The surgeon moved his finger lower. The record shows 3 missed calls, he said. Then 1 completed call. Dad's mouth tightened. The surgeon read the note out loud. Father informed. State's family will arrange care. The room went completely still. Even the monitor seemed louder. I stared at that sentence until the words stopped looking like words. Father informed. Family will arrange care. No appointment had ever been arranged. No specialist. No follow-up. No explanation. Just years of being told I was dramatic, fragile, difficult, attention-seeking. Aunt Linda covered her mouth with one hand. She took 1 step back from my father, then another, like the space between them suddenly mattered. Dad looked at the paper, then at the surgeon. "This is being twisted," he said. The surgeon's voice did not change. "Your daughter needed treatment. The records show you were told." Mom shook her head quickly.
No.
"No, I signed things, but I didn't understand. They said stress can affect girls her age. They said." The surgeon turned the second page. 6 months after that first result, Mara was seen again. Similar findings: weakness, dizziness, weight loss, abdominal pain. The discharge paperwork again recommended follow-up. He slid the page closer. My mother's signature was at the bottom. I felt my stomach twist, but this time it wasn't only from pain.
I remembered that day.
I remembered barely being able to stand in the parking lot. I remembered Mom buckling me into the passenger seat because I was too dizzy to do it myself. I remembered asking, "What did they say?" And Mom saying, "You're stressed." They said vitamins. Now her signature sat under the truth. Aunt Linda lowered her hand. Her voice came out thin. "Denise, you told us Mara refused help." Mom's lips parted, but nothing came out.
Dad pointed at me.
She made everything impossible. Every month it was a new symptom. Every dinner, every family event, she had to make herself the center. The nurse moved closer to my bed. Not because I had asked her to, because Dad had raised his voice. The social worker looked up from her notes. "Mr. Ellis, you need to step back." He ignored her. "You think this makes you right?" he said to me. "You think humiliating your own parents in a hospital makes you strong?" My hands were clenched around the blanket. I wanted to answer, but for a second I couldn't. There were too many years in my throat. Too many dinners where I had gone quiet. Too many mornings when I had stood outside their bedroom door asking for a ride to a doctor and left with an apology instead. The surgeon spoke before I could. "The diagnosis is not final until we complete treatment, but the imaging is consistent with an intestinal vascular malformation," he said. "It can bleed intermittently. That explains the sudden pain, the fainting, the anemia, the weight loss, and why symptoms appeared to come and go." I looked at him. "So, I wasn't making it up?" His expression softened.
"No, Mara."
"You were not making it up." Mom started crying harder. "We didn't know," she whispered again. But this time, no one moved toward her. No one comforted her. Because the papers were still on the table. The call note was still there. Her signature was still there. Aunt Linda took out her phone with shaking hands. She opened the family group chat, the same one Mom had used from the waiting area, the same one where my cousins had been told to pray for my mental health. She typed one message. "Mara was telling the truth. Stop repeating what Richard and Denise told you." Then she hit send. Dad saw it and snapped, "Linda, stay out of this." She looked at him like he was a stranger. "No," she said. "I should have stepped in sooner." That was when security came to the doorway. Hospital administration had been called after Dad raised his voice at staff and tried to interfere with my care again. The social worker explained that my visitor list would be changed immediately. My parents would no longer be allowed back without my permission. Mom looked at me through wet eyes. "Mara, don't do this." For years, that sentence would have folded me in half. This time, I looked at the patient advocate standing near the door and said, "I don't want them receiving updates directly." The advocate nodded. "We'll document that." Dad laughed once, cold and sharp. "You'll regret this when tuition is due." The social worker looked at him. "That threat is also being documented." His face changed then. Not guilt.
Fear.
Because the things he used to say in kitchens and parked cars and hallways were now being written into a record by people who did not owe him loyalty. After that, everything moved quickly. The report was filed for suspected medical neglect and coercive control. Because I was 22, the focus became my safety, my access to treatment, and whether my parents had used housing, insurance, and money to stop me from getting care. My aunt stayed. She didn't ask me to forgive anyone. She didn't make excuses. She sat by the wall while the nurses prepared me and said, "When you're discharged, you can come home with me. Not for a week. Not until things calm down. As long as you need." For the first time that night, I cried. Not loudly. Just one breath breaking into another while the machines kept beeping beside me. The treatment that followed was not instant or easy. The doctors identified the bleeding source and stabilized me. There were follow-up appointments, medication changes, diet changes, and weeks where walking across a room felt like crossing a mile. But every form had my phone number on it now. Every result came to me. Every appointment was mine. The fallout outside the hospital was quieter, but it spread fast. Screenshots of Mom's posts came back through the same family chat where she had asked people to pray for my mental health. Relatives who had called me dramatic sent long apologies. I read some. I ignored most. Friends from church stopped commenting under Mom's updates. People who used to praise my parents for their patience started asking what they had really known. Dad lost the clean reputation he had protected more carefully than my health. Mom lost the version of herself everyone had believed. Financially, their control broke too. The patient advocate helped me apply for emergency assistance and independent insurance options. My school approved medical leave, then a part-time return. Aunt Linda gave me the spare room at her house, and the first night I slept there, I locked the door out of habit. Then I remembered no one was going to open it and tell me I was faking. Weeks later, my parents asked to visit.
I said no.
They asked for updates. I told the advocate they could receive only what I approved. Dad left one voicemail. "You humiliated us," he said. "You'll regret turning your family into enemies." I deleted it. Then I saved my follow-up appointment in my calendar and packed my bag for class. I was not healed overnight. I was not suddenly fearless. Some days I still apologized before asking for help. Some days I still heard my father's voice before I heard my own. But I went to my appointments. I kept my records. I answered doctors honestly. And when someone asked about my symptoms, I no longer looked around the room for permission to speak. The day the surgeon walked in, I did not just get a diagnosis. I got my voice back. Do you think they got what they deserved? Tell me your thoughts in the comments below. And if you enjoy stories about betrayal, justice, and unexpected reversals, don't forget to like, subscribe, and turn on the notification bell.
See you in the next story.